Hi, this is Dr. Raj Patel, and this topic is on the pathological RBC formations. And I'm going to be talking about the various different forms, but it's just covering the high yield topics that are covered in various different board exams in med school and first year residency in certain specialties. If you want a more detailed discussion and lecture, you can sign up for my course, and you can get that information by contacting me at the link below. But let's get started with these pathological RBC forms. I'm going to talk about the main ones that most people tend to forget about or confuse and are more difficult to remember. So the first one is the acanthocyte spur cell. If you're following me on Med Bullets, you'll see a picture of it. It's these little spikes at the edge of the periphery of the red blood cell. And these are seen in liver disease and A-beta lipoproteinemia. A-beta lipoproteinemia is actually a rare disease. It's an inherited disorder that impairs the normal absorption of fats and certain vitamins from the diet. So mainly we'll see signs and symptoms of in A-beta lipoproteinemia results in signs and symptoms such as severe, anything that's related to severe shortage of vitamins, fat-soluble vitamins mainly. So those are A, E, and K. So you'll see severe deficiencies in A, E, and K vitamin. With A-beta lipoproteinemia. Again, it's a rare disease, but you will see a picture of acanthocytes or spur cells in that particular pathology. Also, liver diseases, all kinds of liver diseases will give you a picture of acanthocytes or spur cells on a smear. Bite cells are seen in G6PD deficiency, as you can see on the smear, that the bite cell is literally what it says. It's a bite into the cell, and that's usually because a macrophage comes and bites it away. And I'll talk about that in just a moment, why that happens, when we discuss a little bit about the denaturation process. So the next one is a ringed sideroblast. Ringed sideroblast is basically a ring, as you can see in this picture, and there's sideroblastic anemia is the condition. It's the type of anemia that you'll see ringed sideroblasts in, just as the name implies, but it's a ring shaped, so that's what you're looking for in a sideroblastic anemia. In spherocytes, that's the next one. Spherocytes, it's basically a sphere, red blood cell without that central pallor, and that's called a spherocyte, and that is pathologic. And that usually happens. Usually people know about the hereditary spherocytosis, but people forget that autoimmune hemolysis will also present with spherocytes. Autoimmune hemolysis will also present with spherocytes. The target cells, the next one, target cells are basically what it implies. You have a red blood cell with a target in the middle, like a bullseye target in the middle, within the central pallor. And you have four main conditions that go with that. One is asplenia can cause target cells to form on the smear, but also liver disease, thalassemia, and hemoglobin C disease. Hemoglobin C disease is actually very mild. Actually, a lot of times it doesn't even have any symptoms whatsoever. It's a common structural hemoglobin variant in human population. People with hemoglobin C trait are phenotypically normal with no clinical evident limitations or symptoms, while those with hemoglobin C disease, not the trait, which is the HBCC versus HbAC. HbAC is the trait, HBCC is the actual disease, may have mild degree of hemolytic anemia, very mild. They might have a little bit of splenomegaly and borderline anemia. But though it's clinically, the complications of hemoglobin C disease are not severe, inheritance with other hemoglobinopathies, such as hemoglobin S, may have significant consequences, and genetic counseling as a result is needed, and anticipatory guidance play an important role in providing care for these individuals. So, not a huge high yield disease, but it's good to just know that hemoglobin C disease can cause target cells, just like thalassemias, asplenia, and liver disease. Now, the next one is Heinz bodies, and Heinz bodies are basically, you'll see like at the edge, the periphery of the red blood cell, very, very periphery, very edge of the cell, a blue body, a blue circular body. That's called a Heinz body. Now, a Heinz body is what leads to bite cell formation. We said bite cells and G6PD deficiency. It's also associated with alpha thalassemias. Now, in alpha thalassemias and G6PD deficiency, you'll have oxidation of the iron, and that changes the ferrous to ferric, the 2+ to 3+, going back to that chemical reaction, if you remember. Denaturization of hemoglobin is what occurs, and that's what happens, and that results in precipitation of this Heinz body, and that Heinz body can damage the RBC membrane. And the denaturization actually itself causes damage to the membrane, and it forms a Heinz body, and macrophages come in attempts to move and remove that Heinz body by taking a bite into the cell. So that relieves a bite cell. So that forms a bite cell. So the Heinz body, attracts the macrophages to come and clean it up, and takes a bite into RBC and creates this bite cell in the RBC because of the Heinz body. And this is associated with G6PD deficiency and alpha thalassemia. Now, last one is a Howell-Jolly body. Howell-Jolly body is also similar to target cell in the sense that it happens with patients with no spleen or a hyposplenia. No functional spleen creates a Howell-Jolly body. We'll talk about all these mechanisms later on when we talk about these individual conditions. Right now, it's just good to relate these types of smear cells, these pathological cells in the RBC to the actual condition. So it's easy to, when you have this memorized, it's easy to relate in the future. These Howell-Jolly bodies are basically basophilic nuclear remnants. It's also blue colored. If you look at this smear, you'll see there's a blue colored within the cell. It's not at the edge, kind of like a Heinz body, but it's more in the middle. The Howell-Jolly body is more in the middle. It's a basophilic nuclear remnant found in the RBC, and that's a Howell-Jolly body present in hyposplenia and asplenic patients. And target cells are also seen in asplenic patients. But target cells are also seen in liver disease and thalassemia and HBC disease as well, whereas Howell-Jolly bodies are not. Thank you very much.